there are clear signs when something's come out of control, that they no longer have a capacity to stop themselves from doing it. And for example, if a person is, their addiction is pornography, when it's getting in the way of their regular everyday life, when they're isolating themselves, when they tell me their history and I start seeing the connections between like real isolation, where they're just spending days not contacting family or friends, they're online all the time, they're addicted to their phones is the big one, when they can't go to bed at night without looking at their phone, when it's affecting their ability to perform at work, even at play.
I think the question you need to ask yourself is how long do you want to just white knuckle it, or how long do you want to power it through? Because it's exhausting. It's energy. It requires lots of energy to hold emotions and to keep something inside, or emotion or secrets, something that needs to come out and be processed. It takes energy to hold it. So how long do you want to keep it?
One of the indicators that a person might need therapy is if their dynamics with people are changing in a negative way. So if they're treating their friends like their therapist and kind of unloading and offloading all of their burden and trauma onto their friends, and they're not able to reciprocate that, then that would be a sign that they need therapy, like if they're essentially treating their friends like their therapist. So that actually happened with one of my clients. She's like, we started last year, and she said, I realized that I needed therapy because a lot of my friends were becoming upset with me that I was telling them all this stuff and they didn't feel that I was there for them. So if you can't have that mutually beneficial relationship, it's not a friendship anymore, it's a therapeutic relationship.
I think when someone says that they feel stuck, especially if they've exhausted a lot of different avenues. And if you see like a friend or family member just like spinning their wheels in the same issues for a long time, I think just, I think it's worth getting an outside perspective, someone who isn't part of the story. And so I'll often say, well, maybe you should check out counseling.
I guess I would like to encourage people to see therapy in the right light, because mental health used to have lots of stigma and still has for many people, and we need to take apart this stigma. We're all humans, we're all on continuum. This person might have a little more symptoms, you have less, but it's the same continuum.
Also your mood. So if you're finding that you're going through some like interpersonal conflict or something, and you're finding that you're really sad every day, or like, for example, if you're crying every day, that's probably not good. Just kind of developing that kind of self-awareness to say like, oh, I'm not myself right now. And what do I need to do to get back to who I am and where I want to be? And I think that would be a good indicator of if that person needed therapy.
Well, it's like anything else. You try it on your own, and it doesn't work. You try it again, and it doesn't work. You look up YouTube videos, and it still doesn't work. And then you should probably go talk to somebody, right? And most people know that. They know they're at a point where their blind spot to navigate this is just too big for them, and someone else gives you an insight into what you're not seeing, right? And basically that's what a therapist does. They help you like hold up a mirror to your psyche and help you sort of see things in a new way, and then you find your way out. We aren't breaking you out of jail, we're helping you find the key.